Hello, my name is Eileen, and today I'm going to be talking about aripiprazole. Aripiprazole is an antipsychotic drug that goes by the street name Abilify. It can be taken orally as a pill or a tablet, or it can be administered via intramuscular injection. Users will generally feel its peak around 3 to 5 hours, and it will take the body up to 3 days to eliminate it. It is used to treat a variety of disorders, including bipolar disorder, treatment-resistant depression, irritability associated with autism, and most commonly schizophrenia. Aripiprazole is considered an atypical antipsychotic medication because unlike other antipsychotics, it's able to treat both positive and negative symptoms of schizophrenia. Individuals with schizophrenia experience positive symptoms or changes in behaviors or thoughts that are abnormally present. These can include hallucinations, delusions, or disorganized speech and behavior. They may also experience negative symptoms, such as decreased motivation, asociality, diminished expressions, and decrease in pleasure. Dopamine is the neurotransmitter involved with reward, movement, motivation, and mood. There's a hypothesis that the positive symptoms of schizophrenia are due to an excess of dopamine, and that the negative symptoms are due to a lack of dopamine. Aripiprazole can help stabilize these dopaminergic systems as a partial agonist at dopamine D2 receptors. This means that in areas of the brain with high dopamine, aripiprazole will bind to D2 receptors and produce a weaker effect than the natural dopamine transmitter. As you can see in this diagram, excess dopamine is being released from the vesicles of the presynaptic neuron so that they can bind with the postsynaptic receptors. This excess is associated with the positive symptoms of schizophrenia. Once aripiprazole enters, it's able to bind to the D2 receptors instead, blocking the natural dopamine transmitters. This action results in its antipsychotic effects. In areas of the brain with low dopamine, aripiprazole will bind to its receptors and increase dopaminergic action. In this diagram, there's a small amount of dopamine being released from the vesicles. There's not much postsynaptic action. Once aripiprazole enters, it's able to join the dopamine neurotransmitters in binding to the D2 receptors. This mechanism is related to its positive effect on the negative symptoms of schizophrenia, such as low mood, depression, and irritability. Aripiprazole is known to be a safe drug. It is not a scheduled drug, meaning it's not addictive and it's rarely lethal. A case study of an intentional overdose by aripiprazole only caused mild sedation, so this really supports its safe therapeutic use. Though it is a relatively safe drug, aripiprazole does cause side effects. The most common include orthostatic hypotension, which is low blood pressure after sitting or laying down for a period of time, headache, nausea, tremors, agitation, and insomnia. It can also result in akathisia, which is a sense of restlessness, both physical and psychological, and an increase in compulsive behaviors such as gambling. However, compared to other drugs, it is non-sedating and has little risk of weight gain. In comparison to placebos, aripiprazole should be more effective in treating symptoms of schizophrenia and result in less relapse. However, use of placebos can be beneficial. They're cheap, non-toxic, and have no side effects since they do not include active ingredients. Placebos can biologically promote a release of natural neurotransmitters such as dopamine that can ameliorate the negative symptoms associated with schizophrenia. The expectations of the user, as well as their conditioned reactions, could also potentially temporarily relieve psychotic symptoms due to changes in psychological perceptions. So placebos really could be helpful in short-term relief from symptoms of schizophrenia. Individuals with schizophrenia should avoid using illicit drugs like phencyclidine, otherwise known as PCP. Contrastingly to aripiprazole, PCP is an agonist at glutamate NMDA receptors. These receptors are related to memory, so its use can cause effects of analgesia and amnesia. It is also known to block dopamine receptors as well as acetylcholine receptors, which can cause an increase in both neurotransmitters. It is psychologically addictive, and at toxic doses, it can even produce effects similar to the positive and negative symptoms of schizophrenia. Use of PCP can exacerbate one's state of psychosis and would be extremely detrimental in treating someone with schizophrenia. It would produce essentially a contradicting effect to aripiprazole. Ultimately, aripiprazole is a safe and versatile drug. Its unique mechanism of action as a partial agonist makes it favorable over other antipsychotics. Its side effects are also tolerable in comparison, which makes it a specifically great choice in treating schizophrenia and gives it a lot of potential in treating other disorders as well.